Welcome to the HCA Module 1 lecture. Hopefully you've had a chance to take a look at the opening video that kind of describes the course, as well as a little bit about myself. Today we're going to talk a little bit about basic computer hardware networks and HIT. Now, as I mentioned before in the previous video, why we utilize IT in healthcare. And you have to remember that healthcare is a vertical like other verticals, and it has the same or similar business operations that other companies or corporations have, other verticals have. So a hospital, like any other company, will have similar needs with respect to IT, including supporting their business operations. In this specific situation, managing admission and discharge of patients, as well as any charges to their accounts, and of course billing. It also supports, healthcare IT also supports healthcare operations like schedule and reporting for accreditation purposes, provides the ability to allow for clinical documentation by clinicians to report on the patient's condition as it improves or deteriorates. And of course, we hope that it does improve. It also allows for the facilitation of information and patient data between caregivers, as well as between the caregivers and the billing, whoever's paying the bill, whether it be insurance or the federal government, Medicare, Medicaid. It's also utilized for improving patient care and safety through either decision support as well as quality indicators. And of course, it provides a certain amount of security with that protected health information. Now, I hope you had a chance to read chapters 1, 4, 6, and the external resources. Please also watch the video, because this week we have 4 objectives. The first of which is to identify the basic components or elements of a computer system and the infrastructure, and that's going to be covered quite a bit. Now remember, this is not a computer class. However, a basic understanding is required and is provided to you with the reading materials and the video to help understand the healthcare IT subject matter. The next, and that'll be a self-study to a degree, where you're actually going to be reading and doing some of that stuff on your own. Hopefully most of you have a basic understanding of information technology, at least with computers and with networks, and the basic understanding of how things work. Otherwise, I find it very hard for you to actually attend this lecture if you didn't have any idea of how computers work. So they're very ubiquitous in our life, and we utilize them quite heavily. So a lot of this will be pretty basic understanding for many of you. As far as describing the categories of healthcare, as I mentioned before, the business information systems that keep the hospital running, the registration systems, or the ADT systems that we may talk about later, scheduling systems, including the master patient index, which has been mentioned before, that allows for some sort of a place or a location for patient information to reside and for it to be tied to, would be that MPI. We also have pharmacy information systems, and again, we talk about the decision support systems with allergies or contraindications, certainly weight-based formulations, the lab information systems, which interact with other systems to allow for transfer of information such as lab results. Imaging is also very big, especially with the picture archival systems. When you go in for an X-ray or an MRI or a CT scan, a lot of those images are then archived so that the picture can be pulled up later by the healthcare professional that's looking at to either treat or to diagnose that specific issue or illness that the patient is presenting with. Electronic health record systems. We'll talk a little bit about EHRs, EMRs, and patient health records, PHRs. And electronic medical records, just to get this out here, is really the electronic medical record for that particular facility. When we're talking about an electronic health record, that is transcends the facility and goes beyond to other facilities, to ambulatory centers, to perhaps to insurance companies. Certainly that whole health information exchange would be in that electronic health record. Now with the patient health record, that's more specific to the patient and stuff that the patient can control and maybe even contribute to from their home, whether it be blood glucose results or BiPAP or CPAP settings. So those are some things that the patient can actually contribute to and has a little bit more control over, rather than the facility which kind of owns that electronic medical record, even though it's the patient's personal information. The clinical decision support systems, we've talked about that already. The data points that are brought together to create information. There can be rules that are put together in these systems so that clinicians are alerted when a certain threshold is reached, or a tolerance is reached, or a lab value, or a maximum dosage has been reached. So those clinical decision support systems usually are integrated with the electronic medical records or electronic health records to allow the clinician more information by which to make decisions. The third objective for this week is to talk about the typical positions within a healthcare information technology department. And there's really three levels of personnel in a IT department. It's really in any IT department, but specifically in healthcare IT, we're looking at clerical, professional, and technical personnel. The clerical personnel in a healthcare IT department provide administrative support, scheduling coordination, documentation and reporting requirements, whether it be for magnet status for nursing, or for the Joint Commission, or for any other reporting that they might have to the federal government, to CMS, as well as any privacy and security reporting. Typically, those are handled by, the reporting is actually handled by the administrative assistants. The next level of staff, if you will, is the professional staff. And those could be systems analysts or programmers. And the differences between those two, the systems analyst really is looking at a more holistic view of technology, and they're more of the translators. So they're looking at what the end user's needs are, as well as the technical requirements or capabilities of the organization. And the programmers are that more technical software and maintenance type person. They may not have certainly the personnel skills, but also maybe the soft skills, but certainly not the clinical knowledge but they're very important and integral because of their specific knowledge base that's really geared around the technical aspects of the software. We also have technical staff that are operations driven. These technical managers have to maintain that computer and network environment and have a knowledge of the hardware and software requirements of the system. These operations-driven technical staff, the managers, also have to understand the physical responsibilities in a currency of technology to keep abreast of what's going on right now, and of course have those people skills because they're really concerned with the operations. Now keep in mind, like I said before, healthcare is a vertical like any other vertical that's out there. It's an organization like a bank or like any other institution that's out there, and there are operational needs. So these kinds of skills do transcend beyond just healthcare, but having that healthcare knowledge, that background, is really integral in understanding what your specific clients or end users are needing. We go into the IS Operations Supervisor. And those are the ones that really maintain that computer and network environment, and they have to have that knowledge of hardware and software with the responsibilities as well. Technical staff would include programming, system maintenance, network maintenance, data preparation, even medical equipment upkeep and repairs. The durable medical equipment on the floors like bladder scanners or IV pumps must be maintained, and typically they do have some sort of an interface to the electronic medical record. So they are providing patient data or data about therapies for patients and automatically populating the electronic medical record, thereby removing the clinician from that formula, so that it's another layer of veracity, of truth, where there's not the transcription error of a clinician or a non-clinician transcribing results from a device into an electronic medical record when you have that interface in place already. Some other positions, again, these are very typical of any IT department, but certainly in healthcare: end user support, help desk for the IT, help desk for the HIT. So you might have a help desk specifically for people that are having computer issues, but there also might be a help desk for people that are having issues with the electronic medical record or some of the clinical decision support systems. Software evaluation, perhaps software education. Certainly when we have these different medical records, or we have end users that have updates to they're either brand new coming into the facility, or an update has been applied to the EMR, then those need to be trained by people. So there are software education and EMR software education. And of course there's clinical strategists who are / translators. And those are the ones that are really looking out and going, okay, what do we need? What do our end users need? What do our patients need? And how are we going to bring those to light so that the people in IT are understanding what their end users are actually asking for? The next section of our requirements this week, of our objectives this week, we're talking about the CIO priorities. And really the priorities and challenges for CIOs, even though they're on an annual basis ongoing, there are some unique challenges. Now these, and it really varies depending upon who you talk to. Your CIO might have a little bit different priority or strategy for the upcoming year than other CIOs. But one of the things that we look at are surveys that are either put out by HIMSS or Gartner, or for example, healthcare technology. So in this specific example, Gartner went ahead and put out a put out a survey, and CIOs responded and said that these were the major priorities for them for 2018. And they really synthesized them down into these 6 areas, which is to collaborate with CFOs, chief financial officers, and chief medical officers to align IT capabilities, along with implementing system-wide architecture to support their technology management. Of course, establish key performance indicators, because you can't really manage what you can't measure. Evaluate the value of existing technology and investments into those platforms. So what do we have? How well are they doing for us? And do we need to invest more? Or did we invest too much in them and we need to back off and invest in other areas? Developing new ways to assess those electronic health records, as well as mastering the soft skills. And those soft skills really have a lot to do with what I like to call transformational management. And what it is it's really kind of change management. Change is good, you go first. And you'll hear that again some of the time in the future. But how do we get people who may be reticent to change to more readily embrace the change and move forward with something that ultimately will improve economically as well as patient outcome and cares? So these soft skills are also a priority of CIOs. Another organization, Healthcare Informatics, shows their priorities a little bit different, and the way they differently, and the way that they show those is basically in a percentage of what percentage of CIOs have determined that this is an issue. So for example, 40% of CIOs that have been polled in 2018 said that deploying enterprise analytics was one of their priorities. 71% integrating with the EHR. And it's amazing that here we are in 2018, and still one of the big things, one of the big issues is still that integration of the electronic health record along with other systems in the hospital. Physician buy-in is still a big issue, as well as optimizing EHR integration with other hospital systems. 79% said secure messaging and communications, including alerts from clinical systems and critical test results, are important. And here's the very interesting thing, and this is what I want you to look at whenever you're seeing information like this out there about, for example, in these priorities for CIOs, is that 79% say that this is a priority for them. But if you look at the next item down, 70% of the CIOs do not have a mobile tech strategy in place. So although their strategy or their priority is mobile alerts, mobile clinical system and critical test results, they still don't have that in secure messaging. They still don't have a mobile tech strategy in place. So keep that in mind as we're going through this course, as well as you're going through your healthcare administration academic career, is that a lot of times we have objectives or we have priorities to help hospitals, to help healthcare, to help clinicians, to help our patients, and yet we haven't implemented those things yet. Even if it's a priority, there's still a lot of work to do. Now, just a reminder, please review this lecture as well as the assigned resources and complete the assignments, discussions, and quizzes by the due date. I trust that this was a brief enough lecture for you. Again, go back and look at computer systems and network. That'll also be on the quiz. And thank you very much for listening.